is stuff you learn in university.
Yep.
And depending on the character of the dentist, if he needs to upgrade or if he questions it, I was always questioning everything. So why am I learning this? This is not in terms of I have to learn, like that sucks. More like, why am I learning this? Who invented it? And you have to see the history. Like, dentists weren't medical professions 100 years ago. We only were craftsmen, like to repair a hole. Mm-hmm. And an amalgam filling is a material that lasts forever. It kills bacteria. It is easy to apply, and it's almost for free. And this is why amalgam actually won 200 years ago. So in the US, there were these doctors. There was one body. It was called the American Association of Dental Surgeons or something like this. And they could only do little gold fillings where they would hammer in these fillings. And they probably did 2 a day because it's like really tiny work. And then there were these French guys coming in to the US who had amalgam alloy. And they could do 20 fillings a day. So the dental surgeon told him he should stop with the mercury because they were already seeing chronic problems or diseases with their patients. But because the other ones were able to do more fillings on a day, it was a better profit. So they formed their own body, which is it's history, and I wasn't there, but this is the storytelling. And this is still the American Dental Association, which survived. The surgeons didn't survive because they could only do 2 fillings a day and the other ones could do 20. So it's always the same. It's about industry. It's about who wins and who has the better marketing. So you could market the shit out of a metal mouth. Like, you want to be a cyborg. You want to have the metals in your mouth, like Terminator, amazing heavy metals in your mouth. And then the people would buy in, like they put in earrings and piercings and tattoos. I'm quite sure they would love to have a gold tooth.
I was going to say, it's pretty cool back in the day to have a gold tooth, right? That was like gangster.
It is, yeah. A grill is still gangster, but you could take it out. And still, there are countries where it is a sign of a higher status if you have gold teeth. Still, so it's all depending. And same with the titanium implants. The first implants actually were ceramic, and at least here in Germany, in my hometown, where one ceramic implant was invented in the 70s by a professor named Willi Schulte, here in Tübingen, where I live. He invented the Tübinger ceramic implant. And this one, he had the problem that it broke because it was aluminum oxide, and aluminum oxide is a bit too soft. There are still histologies nowadays, 40 years later, of ceramic implants from him in the body, perfectly osseointegrated, like it would be something natural in your body. But because they broke, and he wanted to test something new, and he asked in the 70s or early 80s, he asked the local health authorities if he's allowed to do a study comparing his ceramic implants with the newer titanium implants. And he wasn't allowed to do the study because they said titanium is not allowed in your body. Then, I don't know, the last 30, 40 years, only titanium was marketed, and this was the gold standard. A titanium implant nowadays looks exactly like a titanium implant in the early 80s. No chance. It would be like I would hang out here with the phone on a cord, but I'm having an iPhone and I can talk to you through a video. So here's an upgrade, which we didn't do in medical or in dental school. So the training in school is the groundwork. We need this for sure, but it is really outdated and it's so super slow. I don't know why it is so slow, but it's probably because it's so big to train on a higher level. But we have the newer professors coming in. They're finally adopting all these things. So we're doing research, luckily now, for about ceramic implants. I'm doing 2 studies with my clinic, and with the whole team, we do like about 20. We have a body called the International Society for Metal-Free Implantology. It's also partnered with the international, with the IAOCI, which is the International Committee of Oral Ceramic Implants in the US. So the German ISMI and the International Ceramic Implants, we're now together forming bigger groups. Ceramic implants are just a part of biological dentistry. It's never about implants, never. It's just a piece that I need to repair. It's not more or less. But the good thing is the ceramic implant, for example, only heals in your body if your body is able to build bone and tissue, and this is where my specialty with nutrition and all these things come in the functional medicine part, and all these bone healing protocols and nutritional designs, because the titanium implant, which the regular surgeon does, it also integrates by a total different procedure. It also integrates to an ongoing cytokine production, like chronic inflammation. And this is why it keeps being in there, whereas the ceramic implant just will fall out if your body is not able to be anabolic. So we have to take care about the overall structures, which is really good, because nowadays ceramic implants are popping up because of aesthetic reasons. But these doctors now, I can now come through the back door and teach them the other things, like all the mindsets about functional medicine, health optimization, and how to upgrade your practice to become a health optimization doctor / specialist in surgery, dentistry. We need both at the same time, but the future mindset should be that a healthy body is immune against cavity. You will never need a drillable hole. It is immune against spacing problems because the mom is prepared well for pregnancy. You have all the nutrients, you have wide jaws, you don't need braces, you don't need your wisdom teeth to be removed, but it is future.